We're back tonight with more about the fine print in the president's new health care plan. And tonight it's about the 75 million or so Americans who get their health insurance through large employers. During this traditional insurance enrollment period, as you may know, some folks have been surprised to see some out-of-pocket cost increases they weren't expecting, in part because of the new law. Tonight, our senior investigative correspondent Lisa Myers explains why.
When Billy and Aaron Baker and their 2 kids in Milwaukee got their insurance notice this year,
co-pays are staying the same for doctor's visits.
They were pleased their premiums will go up only $4 a month next year, but were shocked to discover they're getting less coverage for their money. Their deductible has gone from $0 to $1,000, with a $2,500 out-of-pocket maximum.
I look at the whole realm of things and say, what's going on? Why is it getting worse, and why are we having to pay more?
Hip surgery, which cost Billy only $375 this year, would cost as much as $2,500 if she'd waited till next year. Aaron's employer wrote that the changes are needed to avoid the excise tax imposed by the new health care law. It's known as the Cadillac tax and hits the most generous health plans beginning in 2018.
Saying that your insurance is too good, so we're going to give you a penalty, is kind of outrageous to me.
One survey of Fortune 1000 businesses, which employ more than 20 million Americans, found 60% said this looming tax is already having a moderate or significant influence on benefits. The Cadillac tax is designed to make companies and workers more cost-conscious. The thinking is that if workers have to pay more expenses themselves, they'll avoid unnecessary procedures, and that will bring down overall health costs. The president's top economic advisor insists the tax ultimately will hit only a small percentage of plans, and 4 years from now. When employers notify their workers, they're saying that one of the reasons for greater out-of-pocket costs is the new health care law.
I don't see that at all. There is nothing in the law that tells you need to raise co-payments or deductibles. In fact, the law limits your ability to shift costs to your workers.
Most employers are looking forward to this Cadillac tax in 2018 and realizing they're going to have to get ready for it now.
Employers have been asking workers to pay more for years, even before the new law. Still, it's causing anxiety for the bakers.
If this is what next year is going to bring, what are the following years going to bring, really?
Lisa Myers, NBC News, Washington.